Occupational therapy is about mind, body, and spirit. It's about the important roles a child plays in their life to be a friend, a child, a player, a learner, how they use their muscles, their body, their mind to do functional, meaningful, fulfilling tasks. The role of an occupational therapist is to support people to achieve lifelong learning, function, meaning, and purpose in everyday activities. An occupational therapist would support a child with autism and their family to fulfill the goals that they have in life. The brain of someone with autism is a phenomenal thing. It's just different to a neurotypical child. So an OT looks at how autism impacts their brain and their body, their capacity to connect with their family and to make friends and to socialize, a child's capacity to learn and take in information through their senses. We look at how the environment impacts a child with autism and how we can modify that and change that to help them to access everything in their home, in their community, in their school to learn and to flourish. One of the things that impacts children with autism can be their motor skills, how their brain and body coordinate and integrate for function, how their eyes and hands work together, their feet and eyes work together. And this can impact gross motor and fine motor skills, which are all needed for looking after yourself, doing up zips, holding a pencil, eating on your own, brushing your teeth, and all those other important things that we want our children to learn. OTs work with children and families at the level that they're at. We can support them all the way from learning how to explore and learn about their environment, all the way to learning how to cook a meal all by themselves. OTs work with children with autism and their families in all different environments. Sometimes it's the natural environment of the home or the local park. Sometimes it's the preschool or the school. Other times the OT clinic where you can work on some intensive skill building. OTs often work at a school, collaborating with teachers and teachers' aides to support a student with autism to function and learn to the best of their ability. Ideally, a child with autism and their family would have a multidisciplinary team. That means that many people with different knowledge would come around you and support you to understand your child better. While OTs look at fine motor skills, a physio might look at gross motor skills, a speech therapist, communication, and a psychologist, behavior. We all work together to learn about the intricacies of your child's body and brain and how autism is impacting their function. Sometimes therapists have sessions together, and this can be so effective when we're in the same space together, collaborating with you and observing, assessing, and providing strategies for your child. The partnership between OTs and parents, carers, teachers is absolutely vital. OTs just drop into your life, but the parent, carer, and the child connection is the most important thing. OTs look to equip, support, mentor, build up, skill build the people and the knowledge around the child with autism. The most important people in a child's life are the consistent adults who are there daily. And the OT would look to equip and support those consistent people to be confident and connected, to be grounded, present, centered, and knowledgeable about autism, about their child, in order to support them.